Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Medical Center. Today is Thursday, June 25th. Let's take a look at the three graphs that we are familiar with. The first one shows activity in the capital region in 8 counties. More of the same. I think if you look at it closely, you might see that there's a little blip today compared to a couple days ago. I don't know if that's statistically significant. We'll keep a close eye on it.
Yeah, we'll keep an eye on it.
But there are 40 people currently in hospital beds. There was 37 a couple days ago being treated for COVID-19, and ICU is the same number, 5. And Fred, we've talked about this. The fact that we can look at data on a daily basis will really be an ability for us to tell whether or not they're going up or down.
Absolutely, Dennis. It's very, very helpful. But we also have to look a little bit at the average of that.
Right.
Little blips like we see today
right.
probably are meaningless.
Meaningless, and it's a good point to mention, and that's why we're talking about it, so we don't overreact to data either way.
Exactly.
Either way. The activity inside here at the medical center, we're looking at COVID-19's admissions and discharges. This one visually tells the story. A lot of activity below the line, which are discharges from the hospital, and that's great news. And then let's throw up the next graph, which is the people in the hospital every morning with COVID-19. This continues to be a great story. Fred, we currently have 14 people in the hospital with COVID-19, 12 on the floor, 2 in the ICU, none on ventilators. And when you back out those people who are waiting for congregate living facilities, it's 8. So really, we're talking about a fraction of the people in the hospital.
Very small number. About 10% of our peak.
Yeah, which is remarkable.
Yes.
So great news. All right, let's jump into a couple other activities. One of the things that we're learning is that when we do these videos, we're often making some mistakes. I've made many of them with people's names and the departments they're in, but we always get to correct them. So Fred, you want to pick up a name we talked about the other day, Dr. Wales.
That's right, Danielle Wales, one of our physicians who won an award at graduation. I mistakenly said she's an internist working at internal medicine, and I know this. Danielle's actually a med petter, an internist and a pediatrician working at our med ped office.
Yeah, she's both.
She's both.
But she is remarkable.
And she's very good.
She's very good. All right, so again, congratulations to Dr. Wales. Fred, the governor today just was starting to talk about a travel advisory. A lot to unpack. We may not get through it all today, but what are we learning?
So yes, at his press conference the other day, he basically said that New York, New Jersey, and Connecticut are going to collaborate on travel advisories for people coming out of hot zones. So think Florida right now, California, Texas, etc. So he put out an executive order, and literally just before I walked in here, Dennis, I saw the guidelines that follow that executive order. So there are going to be some restrictions on travel if you travel to one of those hotspots or come from that hotspot in terms of quarantine when you get here. We'll get more into it on Tuesday. It was kind of a lengthy guidance, and I don't have all the details right now.
And I know that you're going to assemble your leadership group this afternoon to look at it and see how it affects us. So more to follow.
That's right, more to follow. We'll talk about it on Tuesday.
Okay. Another topic, Fred, I know you wanted to address was how we enter into the hospital. We obviously reduced the number of entrances back at the beginning of the pandemic. We're reevaluating that, but I think we want to talk some more about that.
That's right, Dennis. When we really closed down visitation, we were seeing 100, maybe 150 visitors a day into the hospital.
Right.
We would typically normally have an order of magnitude more people coming in and out of the hospital on a given day. So we closed down to just 2 entrances. We've been hearing, and we're paying attention to this, that as we open up and more people come into the facility, it's become a little hard to come in through just 2 entrances. So leadership is going to talk about this in the next couple of days. And again, more to come next week. We may make some decisions on changing access into the facility.
Okay, more to follow.
More to follow.
Last night was our journal club, virtual journal club, which I know Fred and I both had the great opportunity to listen in on. And last night's topic was very timely, very important topic, which was health disparities, specifically related to COVID-19. So let me just make a couple comments, and then Fred, you can jump in. I think that we, once again, had some great presentations from the medical students. I want to make sure I get their names in there. So Vilak Desai, Ernesto Acosta, and Nicholas Cochran, I hope I'm pronouncing this right, Kagian, were fantastic. And they spoke about COVID-19 at an international level, and then a national level, and then a local level, and they presented a lot of data. And I thought it was a really incredible conversation.
It was really terrific. I'm actually wearing a college
Right.
T-shirt today,
Right.
sort of a shout out to the college in general and the medical students in general that have been running these journal clubs for us. But I learned a lot. I really did learn a lot.
A couple people participated that I think we want to mention. So Dr. Coates always leads it.
Yes.
We spoke last week about the appointment of Dr. Antonikowski, who's our new Chief Officer of Health Equity, Diversity, and Inclusion. So she was an active participant. Dr. Megan Applewhite, who's a practicing surgeon, but she's also director of our Bioethics Institute,
Yes.
led us through some great conversations. And it was and the community participated. We had physicians not from Albany Med dialing in and listening, which was great.
So we sent the link out to all the physicians who participate in our regional calls.
Right.
So they jumped on and had some things to say as well.
And if you didn't get a chance to see it and you're part of the Albany Med workforce, you can go back and look at these virtual journal clubs. They're on Sakai, which you can find on the intranet. And I encourage you to go back and listen to that one last night or any other ones. They were great.
Very thought-provoking.
You mentioned you're wearing Albany Medical College. I'm wearing a shirt for recreational therapy. It's great to be wearing our workforce shirts again.
Yes.
Recreational therapy is one of those things, like many things we talk about, which are part of the whole environment of healthcare here. And they provide an important outlet for people who are in the hospital, being treated, who sometimes need a little diversion, and actually helps with their healing process.
It absolutely does.
And they're specialists in their own right who deliver this. So
That's right.
We thank them for that. Fred, also, we talked about awards earlier in this week. There was another award given out. This one is for the Graduate Student Award Day. Talk a little bit about our graduate program here. We have more than just a medical college.
We do, Dennis. So we have multiple different scientific graduate programs, so Masters of Science,
Yes.
as well as doctorates in multiple different areas.
Right.
In addition to those basic science areas, we have a CRNA school,
Yes.
certified nurse anesthetists, as well as a PA school, physician assistants. So those are all graduate level programs.
Yes.
And actually, there's a fair number of students in those programs.
There sure is, and they recognized one of the best last night. So this is the Graduate Encouragement and Merit Award, and it was actually given to someone from our PA program, Dr. Wilson Crone, who's on faculty there. So congratulations to Dr. Crone. Very good. Finally, Fred, let's talk a little bit about something called the Patient Family Advisory Council. They had their first meeting last night, and this is really important. This is an opportunity for the medical center to have members of the community come in and help us with our thinking. We launched this about a year ago, and we're starting it in the Children's Hospital. And can you talk about why these are important?
So first of all, it got a little derailed because of COVID, but it's now getting back on track, as are a number of things across the house. The idea is to bring families in to talk about their experiences and to give us feedback and guidance and help and how we can do things better. And not necessarily the very technical medical things, but some of the other things. Rec therapy, you mentioned, is very important. The whole view of the patient when we care for them. There are other aspects that are very important to healing. So there were 7 families, I believe.
7 families.
Matt Markham, Matt, talked about social media. We were told it was a very, very good meeting. We'll hear more about it at Hospital Affairs, one of our board committees.
So this is Dr. Ostroff, Chair of Pediatrics. It's Mary Alice Cullen, who's our AVP for Women and Children's, and Ann Martin from RISC, who has some experience with this at other facilities. So the 3 of them are going to lead this effort, and these 7 families will be part of the dialogue, which will make us a better facility.
It absolutely will. And, Dennis and I said, it got a little derailed because of COVID, and now we're getting back on track. We're getting back on track on a number of things, and I just wanted to mention the birth classes.
Yes.
So those kind of got put on hold because of COVID for the obvious reasons. Those are going to start up. Again, a very important aspect to the care of mothers who are going to deliver soon. So those are going to start in August. We're going to hold them across the street at 391 Myrtle. We're going to be very careful, relatively small classes, do all the important things to keep them safe. but start to educate our families around their experience that's about to happen.
That's great. It's so great to talk about the numbers coming down. It's also so great to talk about other things which are coming back online, which we used to do and haven't done for a while or are new.
That's right.
That's wonderful. So we'll be back again on Tuesday. We go Tuesday, Thursday, so we'll be back again Tuesday, and we'll see what we have next week.
That's right. I'm sure we're going to have a lot.
Very good. All right. That'll do it. Please have a good weekend. Once again, please take care of yourself, take care of each other, and we'll see you next week.